The C word. Among thousands of other diseases one can contract, cancer is one that still does not have a cure, causing people to associate words like fear, uncertainty, pain, and suffering at the mere thought of cancer. With over 100 different types, cancers are scary, as many occur randomly. However, some must be considered as self-induced. For instance, breast cancers can be caused by smoking or exposure to carcinogens present in one's environment. In some cases, this type of cancer can occur in people who have not been predisposed to any carcinogen nor smoke. Why, you ask? Well, breast cancers, including all other forms of cancers in general, are still not fully understood by doctors, making them one of life's biggest mysteries. How can cancers affect someone who has not harmed themselves internally through substance abuse? Are some people more prone to cancer than others? Are cancers caused by genetic mutations? There are so many questions regarding the disease with little to no answers. Personally, I hear about all cancers and their corresponding treatments and prevention techniques on a daily basis at my job, Carolina Endocrine, and my mom's, Cardinal Points Imaging. Utilizing my resources, I had the privilege of interviewing 2 mammography technicians that work at Cardinal Points Imaging, Angela and Izzy. The technicians were able to answer all the questions I had and walked me through how patients are cared for upon receiving the news that they have breast cancer. Breast cancer is a disease formed by the overactive growth of malignant cells embedded in breast tissues. Today, I will be discussing how breast cancer is defined, ways to detect it, types of breast cancers, and the various stages associated with the cancer. It is a known fact that 1 out of 8 women will be diagnosed with breast cancer. According to the CDC, the breast is made up of 3 main parts: lobules, ducts, and connective tissue. The lobules are the glands that produce milk. The ducts are tubes that carry milk to the nipple. The connective tissue, which consists of fibrous and fatty tissue, surrounds and holds everything together. Usually, breast cancers form in the ducts or lobules of the breast and have the potential to spread to other areas of the body through blood and lymph vessels. When the malignant cells spread in this way, the cancer has metastasized, meaning it has become deadly and very hard to treat. What are some other ways breast cancer spreads? Damaged cells in the breast from a mutated gene replicate and have the capability of growing rapidly. This, in turn, leads to accelerated cell growth and can form a tumor or tumors. Accelerated cell growth must occur with the help of 3 chemicals: estrogen, progesterone, and the HER2/neu gene, which is classified as a growth hormone. Another way breast cancers spread are through a cancer receptor. The National Breast Cancer Foundation says, think of a receptor as a mouth. When open, cancer cells can feed and grow. When blocked off or closed, the same cells begin to starve. As seen in the picture, the receptor can bind with either progesterone or estrogen. The aforementioned growth hormone, HER2/neu, helps the infected receptor spread to other receptors, which spread to others until a tumor or mass is present in breast tissue. Identifying cancer receptors are pivotal in doctors knowing how to best block the receptors, ultimately reducing the multiplication of malignant cells. How can one tell if they might have breast cancer? The most obvious symptom of breast cancer is breast pain, but over the years, doctors have discovered that some patients do not have any present symptoms, which is why the National Breast Cancer Foundation tells patients between the ages of 40 and 65 that they must come in at least once a year to receive a mammogram. The cost of a mammogram varies depending on one's insurance, which was a fact I found out by interviewing Angela and Izzy. In my interview, I asked 25 questions. One of them was, which test, 2D mammography or 3D mammography, do you recommend to patients and why? Angela answered, well, I'm not a doctor, so I can't recommend anything, but 3D imaging is better. With the 2D mammograms, the radiologists have one image to look at, and he has to decipher through all of the dense breast tissue. It's just like looking at a photograph. With 3D, our machine takes images in 1 mm slices, so the radiologist is able to look through dense breast tissue in slices. That said, 3D imaging is better. They are both good, however, 3D is more realistic. Patients should always gravitate towards receiving a 3D mammogram, as its results are more accurate and easily read by the radiologists. Shown in this picture is the mammogram machine with 3D imaging used at Cardinal Points Imaging. While at Cardinal Points, Angela also handed me this door hanger that goes into detail about a breast self-exam. The American Breast Cancer Foundation, along with many other resources, encourage women to conduct monthly breast examinations on themselves. Women should perform the test in 2 different ways, in front of a mirror or in the shower. Using the information from the American Breast Cancer Foundation, if conducting the test in front of a mirror, follow these 3 steps. 1. Stand in front of a mirror large enough to view both breasts. Press your hands firmly down on your hips and bend slightly forward. 2. Examine breasts visually to check for any changes in size, shape, contour, dimpling, redness, or scaliness of the breast skin and nipple. 3. Next, clasp your hands behind your head and press your hands forward. Pay attention to any changes in the contour of your breasts. Additionally, if conducting the test in the shower, 1. Raise your right arm and use the pads of your fingers on your left hand to feel for lumps in the right breast. 2. Begin at the outer edge of your breast and move in a circular motion to slowly feel your entire breast. 3. Gently squeeze the nipple and check for any discharge. Repeat the procedure on your left breast. If there are any changes in breasts of women, or in some cases men, it is imperative to go and seek a consultation with a breast specialist. Did you know men can get breast cancer too? Even though it is exceedingly rare, 2% of men are potentially at risk. Most men develop a type of breast cancer called infiltrating ductal carcinoma, or IDC. According to the National Breast Cancer Foundation, the cells in or around the ducts begin to invade surrounding tissue. Very rarely, a man might be diagnosed with inflammatory breast cancer or Paget disease of the nipple, which is ductal carcinoma in situ, DCIS, contained within the nipple and usually the areola. DCIS is among one of the more popular kinds, as 83% of women diagnosed with breast cancer have it, a statistic from cancer.org. In addition to the 4 types I have previously mentioned, there are 7 other forms as well: lobular carcinoma in situ, invasive lobular cancer, triple-negative breast cancer, metastatic breast cancer, medullary carcinoma, tubular carcinoma, and mucinous carcinoma. The term in situ in several of the previously mentioned names refer to how the cancer has spread, ultimately meaning that the cancer is still in its original location and has not spread to other areas of the breast or body. In situ breast cancers are often thought of as the non-invasive or pre-invasive forms, according to cancer.org. On the other hand, invasive breast cancers must be categorized as the kind of cancer that spreads to other surrounding areas of the body. Currently, 70% of patients are diagnosed with invasive cancers, leaving the other 30% of patients to be diagnosed with in situ cancers and rare forms like Paget disease. Along with there being a wide variety of breast cancers, comes different stages one can be diagnosed with. There are 4 stages of breast cancer, starting from stage 1 and advancing to stage 4. Each stage represents a different or new finding in the progression of the tumor or mass in breast tissue of a patient. Let's go in depth on what each stage entails. Stage 1 means that there is a small but effectively treatable abnormality in breast tissue. The types of cancer associated with this stage are DCIS, LCIS, lobular carcinoma in situ, and Paget's disease of the nipple. The next stage is stage 2, which indicates that the breast cancer is growing, but the growth is restricted to the breast, or it has only spread to some lymph nodes. Although this stage is trickier than stage 1, stage 3 has it beat. Stage 3 means the cancer has spread outside of the tumor and into many lymph nodes and muscles. However, the cancer has not yet spread to organs. Once the cancer has spread to organs, a patient has been diagnosed with stage 4 breast cancer or metastatic breast cancer, making it nearly impossible to treat and contain. Ultimately, as the stage increases, so does the difficulty in being able to treat the stage of cancer. Early detection is key to the survival rate of any known cancers, especially breast cancer. Breast cancer is a disease formed by the overactive growth of malignant cells embedded in breast tissues. I have discussed how breast cancer is defined, ways to detect it, types of breast cancer, and the various stages associated with the cancer. With October being Breast Cancer Awareness Month, make sure every woman close to you between the ages of 40 and 65 receive their free yearly mammogram on National Mammography Day at Cardinal Points Imaging in hopes of combating this slow-growing yet potentially fatal cancer. And don't forget to always think pink.